my gosh, I've been trying to exercise. I feel like I'm so out of shape. But lately, I've been feeling my heart pound. My ankles have been swelling up. Something about this just isn't right. I need to call my doctor. After 10 long awaiting minutes. Hello, I'd like to talk to my doctor. I've been having chest pains. I've been trying to exercise. I'm so out of breath. After exercising for 2 weeks, shouldn't I feel better? And my legs are swelling. I just need to see someone. Thank you so much. Good morning, I'm here. My name is Wendy. I'm here to introduce aortic stenosis. I'm one of the RN students. So aortic stenosis, let's break this down first of all. Aortic is in reference to the heart valve, the aortic heart valve. And stenosis is Greek for the word narrowing. For a healthy heart, you have four different valves. The one we're concentrating on is the aortic valve, a tricuspid that has flaps or cusps that open and close to allow the blood flow from the left ventricle through the aortic, pumping through the rest of the body. It's the last valve in the system, and it's really important. Let's dive a little deeper into aortic stenosis. Let's start with the heart. The heart valves open and close, allowing blood to flow through them. This is the flow of the blood. From the right atrium into the right ventricle is deoxygenated blood. Then it travels to the lungs to pick up the oxygen. Then it travels into the left atrium, into the left ventricle, and the aortic valve pumps it out. During aortic stenosis, there's backflow going the wrong direction, which is what causes the problems. And now we're on to the valves. There's 3 tricuspid valves, the tricuspid valve, pulmonary valve, and the aortic valve. Mitral is a bicuspid, not as important as what we're talking about right now, the aortic valve, which is right here. And now we're talking about the healthy heart versus stenotic. So this is a healthy heart that opens and closes. That way it prevents backflow. Now when you have stenosis, calcium builds up along the edges, allowing it to not fully close. And that's what creates the backflow and the problems. For aortic stenosis, it can be asymptomatic until the backflow gets to be a problem. And then you'll have clinical manifestations. Clinical manifestations can get worse with exercise. So it might not be that you're out of shape, it might be aortic stenosis. So first, chest pain. Then you have shortness of breath, dizziness, also you can have lightheadedness. You might feel the need to sit down a lot. Might have peripheral edema of the ankles and feet. Also, you might have trouble sleeping at night, or you'll have the need to sit upright. Lots and lots of pillows. Or you might just have the inability to perform activities of daily life. Things just might become a little bit more difficult. If it is, see your doctor today.
Knock, knock. Hi there, my name's Gabe. I'm going to be your nurse today.
Hello.
Can you get your name and birthday?
Wendy Lab, 96789.
Perfect. You are who? supposed to be. So I have a note here that says you have been feeling some chest pain and been feeling tired all the time. So can you tell me a little bit about what's going on?
Yeah, I thought maybe I was out of shape, so I tried to add some light jogging to my exercise daily routine probably a couple weeks ago, and it hasn't seemed to gotten any better, and my chest pains have actually gotten worse.
Oh, okay. And it just started 2 weeks ago. Did you have any problems before that? Trouble before that?
I think when I was a kid, they told me I had a heart murmur or something, but
Okay.
it went away, and they haven't mentioned it since.
Okay. So tired, some pain in the chest. Are you like dizzy? Do you ever feel like you're going to pass out, or do you pass out?
Towards the end of my run, I really have to sit down.
It's pretty rough at the end. Okay. Well, let's take a look and check out, listen to your heart and lungs and see what we can see.
All right, sounds good.
Should be really quick and easy. So I'm gonna take a look real quick here. Okay. So I do hear a little something there.
Should I be worried?
Well, we'll see what's going on. Yeah, take a deep breath for me. Okay. Let's listen to your lungs here. So every time I move, take a nice deep breath for me.
Okay.
Okay. Okay. And go ahead and lean forward. I'm going to check your back. Deep breath. One more. Listen down here too. Okay. So, sounds like you've got a little possible heart murmur going on. Might be a continuation of what you had when you were a child. So we'll want to check that out with some imaging. And I can feel a little bit of a rub up here. That might mean your heart is having a little trouble beating. And I can hear some crackles and some noise in your lungs. So your lungs might be having some trouble too. But we'll do some more diagnostics and figure out what's going on.
Is that what's making me so tired?
Probably, but we don't really know. We'll have to get down to the details and figure out what's going on.
My ankles have been swollen lately too.
Yeah, that seems like probably what's going on. It's your heart might be having some trouble, but we'll figure out what's going on.
Hello, my name is Amy and I'm a nursing student. We're going to be talking a little bit about how our aortic stenosis affects the body. It affects many parts of the body, specifically the cardiovascular and pulmonary system. As you can see here, it is due to this calcification of the flaps in the aortic valve, leading to decreased blood flow. This leads to the increased work for the left ventricle. The left ventricle enlarges to compensate, but it eventually fails. Due to the decreased heart function, the body raises the blood pressure to compensate. This leads to edema and hemorrhage in the lungs. So these are the lungs, and this is the fluid that builds up in the lungs. So as this affects, as this information, we take it into the symptoms that we see in many patients, specifically Wendy, as we saw earlier. So for the heart, we see chest pain and we see heart palpitations. In the lungs, we see shortness of breath and crackles, as we heard in her earlier. Difficulty sleeping, so specifically we use more pillows to sleep because when we're sleeping, fluid builds up in our lungs and it makes it really hard to sleep, so we sit up more. That's why she's been using extra pillows. And for the circulation, we see edema in both the lungs and peripheral edema. We see fatigue and dizziness, and the biggest one that covers all of this is exacerbation with activity.
Knock knock. Hi there.
Hi.
Gabe, your nurse again. You just talked to the doctor?
Yeah, he said I had aortic stenosis, but I don't understand what that means.
Okay, so your diagnosis came back, and that's what they've decided, and he's decided that you have. Your heart valve, you have 4 heart valves, and they work as flaps. And over time, if those get like calcified, they get a little like calcium buildup on them, they work a little less efficiently.
But I'm in my 40s.
Yeah, so remember when we were talking about before, you said that you had a heart murmur when you were a kid?
Oh, yeah.
So most valves have 3 flaps. Your aortic valve only has 2. So rather than 3 flaps, you've got 2. Means that when most people get aortic stenosis, it's when they're a lot older. Because you only have those 2 flaps, it happens when you're a little bit younger. So you get a little bit more calcium buildup. It's a little inefficient. So it's like if your heart's a pump, your pump's not as efficient as it should be. Little blood's coming back when it's trying to shoot out, not as much as shooting out when it's supposed to. So that's why you're having some fluid buildup in your ankles, some fluid buildup in your lungs. That's why your lungs don't feel so great, and you're tired all the time. So hopefully, we'll make an appointment. You'll see a surgeon, and you'll go through your options with them. But lots of times they talk about a valve replacement or making some alterations to the valve so it works as it's supposed to.
Can
And
they
it
fix
closes.
my heart?
That's going to be fixing it. That's the fix. It's going to be changing the valve itself so it works the way it's supposed to.
And then I'll get to lead a full life?
Yeah, it's almost you'll have to take some medications and that kind of stuff, and it'll be kind of a long process. But you should be able to be athletic and functional and a happy camper after that. But that is stuff that your surgeon and your doctor will talk to you about in the next few appointments that you have.
Thank you.
Of course. Do you have any other questions?
No, but do you have a handout or something that I can look over just so that I can
Sure.
better understand it and re-explain it to my
Yeah,
family?
we've got this right here. So it kind of goes over what a normal heart valve is supposed to look like, and your stenosis is kind of like that. It's a little bit not quite as close as it's supposed to. Yours is like this, but your valve is 2 rather than 3, which is that problem we talked about that you've had since you were a kid. And these are like those symptoms lining up exactly what you've got going on. If you have any questions,
there's where my problem is?
right there. It's the last valve on the way out.
Okay, that makes more sense. Yeah, I have been having some unusual heart beating, shortness of breath especially, swelling in the legs, chest pain, unusual fatigue, feeling dizzy and fainting.
Got the whole shebang.
Wow, I really checked all the boxes.
Checked all the boxes, so I think we've figured out what's going on.
Thank you.
Of course.